If you're experiencing knee pain, just give me a few minutes of your time and I'll help you figure out where it's coming from. Hi Prehab, welcome back to the channel. Dr. Dorian St. Danik here, and today we're going to discuss something that affects a lot of us, knee pain. These assessments will help you rule in or rule out potential diagnoses, but they do not serve as medical advice. If you are experiencing more severe pain, swelling, or your knee is giving way, please see a healthcare professional. All right, if you are experiencing dull, achy type of pain in front of the kneecap, around the kneecap, or even if it feels like it's behind the kneecap, and you're getting these symptoms with squatting, crouching, or running, you may be experiencing Patellofemoral Pain Syndrome. This is an irritation or inflammation of those patellar joint surfaces with or without cartilage damage. To treat, you're going to want to work on motor control of the lower body. You're going to want to work on strength of the hips as well as the foot and ankle. And you're going to want to do a gradual return to those knee-dominant activities. So one of the exercises to address motor control of the torso, the hips, and the foot and ankle for Patellofemoral Pain Syndrome is the fire hydrant with rotations. For this exercise, you're going to need a looped band that's going to go above your knees. And you're going to want to be at a wall. A bench can work well, any sort of post that's going to allow you to place your rear foot against a stable structure. So I'm in this short stride split stance. I'm dropping into a half squat position and I'm tensioning outward into abduction and external rotation using my lateral glutes. I'm going to go ahead and begin to rotate my torso just about 30 degrees to the left, 30 degrees to the right. And what this is doing, it's challenging my hips, my feet and ankles to stay stable as I create a little bit of stability challenge from up above. So as you're rotating, avoid letting the knees come in, avoid letting your hips shift left and right. That means you've lost some of that tension from the hips, from the foot and ankle. So stay steady in your squat, then create the stability challenge with the torso rotations, and you're really gonna feel your lateral glutes lighting up, maybe a little bit on the shins, a little bit on the quads, and finally the obliques at the torso. You can try about 10, 15 rotations for a couple rounds on both sides. You can do this exercise 2 to 3 days a week. So if you are experiencing pain still in front of the knee, but this time below the kneecap, and if you get that sharp stabbing pain with lunging, walking downstairs, or jumping, you may be experiencing patellar tendinopathy. This is a failed healing response of the patellar tendon collagen, typically due to an overuse or overload type of stimulus. To treat, you're actually going to want to load that patellar tendon through isometrics, slow tempo heavy resistance training, and plyometrics. All right, so to address pain as well as load tolerance for patellar tendinopathy, that pain below the kneecap, you're going to want to try the Spanish squat exercise. For this exercise, you're going to need a fairly thick and heavy power band or mobility band. You're going to want to attach that band around a sturdy anchor such as a squat rack, and then you're going to slip into that band to have the contact point just below the knee at the top of the shin. Take a few steps back, you get the tension in the band, and then from here with an upright torso and a little more weight on your toes, you're gonna start dropping into this squat that really doesn't have a lot of hip hinge forward, but rather it's a lot of hinge at the knees. You're gonna find maybe a 60 to 90 degree position at the knee joint, and you're gonna hold in this position. You're gonna try to work your way up to 45 seconds. 30 to 45 seconds will be an effective dose. So if you need a little help, you can use a band up top to help support the load, but this is gonna be a high challenge to the quads, a really good desensitizing effect to the tendons. And you can run through this 2 to 3 sets, and 2 to 3 times a day for that pain relief and that increase in load tolerance for patellar tendinopathy. All right, so if you want more programming to handle that front side knee pain, whether it's patellofemoral or patellar tendon, go ahead and check out our patellofemoral rehab and prehab programs. If you're having knee pain on the inside of your knee, and that pain feels like a clicking, catching, popping sensation, And maybe you're getting that knee pain when you fully straighten your knee, you fully bend your knee, or maybe you pivot and twist. It could be a meniscus injury. The meniscus is a C-shaped piece of collagen that acts as a shock absorber to pressure as well as rotation. All right, to treat, you're gonna wanna work on joint mobilization at both the femur, the thigh bone, as well as the tibia, the shin bone. You're gonna wanna work on quadriceps and hamstrings control at the end ranges of motion. And then finally, you're gonna wanna work on rotational stability and strength from the obliques of the core to the glutes and the groin of the hips, as well as some of the muscles that stabilize our arch at the shin and at the ankle. So here's a clinical test that you can try on your own. It's called the Thessley test. It's gonna put some of that rotational stress into the meniscus area. We can do a single leg stance, and we're gonna let the body turn in and out, and we're doing this with a straight knee. And then we're going into about a 20-30 degree knee bend, and we're doing the same thing. We're twisting left and right, seeing do we get any of that inside symptoms, whether that be pain or some of that clicking, catching, popping sensation. All right, so to deal with that meniscus injury, that inside knee pain, maybe improve your tolerance to rotating, pivoting, twisting, you're gonna wanna try an exercise called anti-eversion twists. We recommend doing this without your shoes on to really challenge the smaller stabilizing muscles of the foot and ankle. You're gonna wanna attach a resistance band at about hip height with the band to the inside of the leg that you're working. You're gonna press that band out. It's gonna create a little more tension that way. And then from here, you're gonna stand on one leg, trying to avoid inward collapse, or that eversion position of the foot and ankle. So as you do this, you should feel the inner shin, the tibialis posterior muscle engaging, and really be mindful to not curl your toes or lift your toes up. Then you're gonna use your plantar fascia, and that's not really gonna give you that rotational stability and strength. You can start off with a 30 to 45 second hold, making sure you're feeling it in the correct region, that inner shin. And then you can progress this to actually a bit more of a dynamic challenge, rotating away from the anchor. And you can try that at about 12 to 15 reps, 2 to 3 rounds, 2 to 3 days a week. And that should give you better tolerance, offload that inside knee, that meniscus structure, anytime you have to get into pivoting, twisting, rotational activities. So if you want more strategies on how to manage that inside, that medial side knee pain, which could be a meniscus injury, you can check out our meniscus rehab and prehab programs. All right, so if your pain is on the outside of the knee, the lateral side, and it's presenting either above the knee joint line or below the knee joint line on this lateral side, maybe it feels kind of sharp, stabbing, and you notice it in shallow knee angles, such as going downstairs, lunging, or the impact during running, you may be experiencing IT band syndrome. So the IT band is this long tendon that comes from the muscle belly of the tensor fascia lata, and it acts as stability as well as energy propulsion to activities that push us forward, kind of like walking and running. It's typically an overuse, overload injury, and to treat it, you're gonna wanna actually put your limbs in hip extension, so the affected leg behind you, and work on exercises such as bridges, split squats, and really focus on improving the control under single leg demands. And then finally, getting that gradual return to those knee dominant activities such as running. All right, to help better manage your IT band pain, so that's pain on that lateral side of the knee, when you're in that shallow knee angle, maybe running, walking downstairs, lunging, you're gonna wanna do exercises that put that hip into hip extension and then really load up the lower body. So great exercise you can do is a rear foot elevated split squat. To set up for this, you need a bench, a box, a chair, something you can elevate onto. You're gonna take 1, 2, and then the third step forward is about the amount of distance you wanna be away from your surface. You're gonna hook the top of the foot. This is the affected leg, right? So this rear leg is the leg I'm trying to work on. You can see I'm in a knee bend here, so I'm getting some tension and stretch to the IT band, and then I'm slowly loading it with a split squat pattern. And we're trying to go into a relatively slow tempo movement, maybe 3 seconds down, 3 seconds up. And that's really gonna help me target my quad and my glute to help support that IT band. If you wanna add an external load, we would recommend loading that inside or that same side limb with maybe a dumbbell or a kettlebell. And you're looking for about an 8 to 12 repetition max, 2 to 3 rounds, 2 to 3 days a week. If you wanna see this exercise, as well as some modifications, some progressions, check out our IT band pain video. All right, so if your pain is in the back side of the knee, like really feels like it's in the knee crease, so it's neither at the shin nor at the thigh, but really in that knee crease area, and maybe it feels kind of like a tension or a tugging. Maybe it's tender to walk, kind of swinging the leg in front of you, or maybe it's difficult to march that leg up. You can even have some sensitivity to rising up on the toes. That might be your popliteus. The popliteus is a small muscle that runs across the backside of the knee, right in the knee crease. It's actually in charge of rotating our shin to help it unlock during movements like squatting, during movements like sit to stand, anytime the knee goes from straight to bend. All right, treatment protocols can include soft tissue release to the backside of the knee right at the popliteus, improving joint mobility with tibial rotation mobilizations, and finally building up the calves and the hamstrings to support that entire posterior chain around loading and stretching. To address your popliteus pain, you're gonna wanna work on tibial rotational mobility. So for this exercise, it's helpful if you're sitting. It's helpful if you have a yoga block or maybe a foam roller to basically help stabilize the thigh position. And then I'm gonna use this slider just to help me take out some of the friction between my foot and the floor. Then from here, maybe I'm starting in about a 30-degree position, and I'm focusing on rotating my shin outward and rotating my shin inward. And this is helping me practice tibial rotation. I can even try this at a 90-degree position. It might be a little bit more of an effect in that straighter knee position because there will be a little more targeted tension to the popliteus. Then after you've kind of gotten proficient with getting this motion right and not dipping from your thigh or your torso, you can try to get it as a full range of motion where we're gonna rotate tibial rotation outward, extend the knee, tibial rotation inward, bend the knee. Tibial rotation outward for knee extension, and then tibial rotation inward for knee flexion. So effectively, this is gonna help mobilize, move around that popliteus, and restore some of the normal mechanics between the thigh and the shin. So if you wanna see this exercise and more, you can check out knee rehab or knee prehab programs in the app. So that's it for today. Hopefully this video has given you some ideas on the source of your knee pain, the cause of your knee pain, as well as some strategies to address your knee pain. Go ahead and check out our app for both rehab and prehab of the conditions we covered today.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.